Concerta in bodybuilding, extended focus, steady energy, and the hidden dangers of methylphenidate. Introduction. Welcome back to our ADHD medication series in bodybuilding. We've already explored Adderall, Vyvanse, and Dexedrine, some of the most powerful stimulant-based drugs used both in medicine and sometimes in performance enhancement. Today, we turn to Concerta, the extended-release form of methylphenidate, the same substance found in Ritalin. Concerta works differently from amphetamines. It has a smoother, steadier release of focus and energy that many bodybuilders find useful during long days of dieting, training, and posing practice. But just like the others, Concerta has a double edge, potential performance benefits on one side and serious physical and psychological risks on the other. Pharmacology. How Concerta works. Active substance. Methylphenidate, an amphetamine-like stimulant, but not a true amphetamine. Mechanism. Primarily blocks dopamine, DAT, and norepinephrine, NET, transporters. Increases extracellular dopamine and norepinephrine, especially in prefrontal cortex, leading to better focus, working memory, and attention regulation. Unlike amphetamines, Concerta does not cause massive dopamine release. It mostly prevents reuptake, giving a more controlled effect. Delivery system. Concerta is extended release. Uses an osmotic controlled release oral delivery system, or OROS. Provides up to 10 to 12 hours of stable effect. Result? Less rush than Adderall or Dexedrine, but smoother focus with reduced peaks and crashes. Why bodybuilders use Concerta. Steady energy for long days. Contest prep often means early cardio, work, gym sessions, posing practice, meal prepping. Concerta provides all-day alertness without constant redosing. Appetite suppression. Like other ADHD meds, Concerta lowers hunger signals, making it easier to stick to a calorie-restricted diet. Mental endurance. During final prep weeks, bodybuilders often report brain fog due to low carbs and extreme fatigue. Concerta helps maintain focus during posing drills, form practice, and strategy planning. Lower abuse potential. Because Concerta releases slowly, it has less of a euphoric spike compared to Adderall or Dexedrine. Some athletes view it as a cleaner stimulant. Scientific context. FDA approved for ADHD and narcolepsy. Studies show improves sustained attention and executive function. Increases dopamine and norepinephrine in prefrontal cortex, leading to better discipline and consistency, highly valued in bodybuilding. Less cardiovascular stimulation than pure amphetamines, but still raises heart rate and blood pressure. Bodybuilding use, dosage and timing. Not a recommendation, for educational context only. Medical dosage, 18 to 72 milligrams per day. Bodybuilding use, often 36 to 54 milligrams in the morning for steady effect throughout cardio, work, and training. Sometimes combined with caffeine for an extra kick. Timing advantage. Unlike Ritalin, Concerta only needs once daily dosing, avoiding constant ups and downs. Side effects and risks. Short-term. Increased heart rate and blood pressure. Anxiety, irritability, or mood swings. Headaches, dry mouth. Insomnia if taken too late in the day. Long-term. Dopamine system downregulation can lead to flat mood or depression when off the drug. Risk of psychological dependence, not as addictive as amphetamines, but still habit-forming. Chronic use during hard dieting risks muscle catabolism because of appetite suppression and calorie restriction. Cardiovascular stress when combined with other stimulants like clenbuterol, ephedrine, or T3 thyroid hormones. Biochemical interactions in bodybuilding. Concerta increases dopamine and norepinephrine, so synergistic with testosterone's motivational drive. But combined with steroids and stimulants, the HPA axis, or stress system, becomes overactivated, leading to cortisol dysregulation and increased risk of burnout. Many athletes underestimate the chronic stress load of stacking CNS stimulants with anabolic cycles. Cardiovascular concerns. Methylphenidate elevates heart rate and blood pressure moderately. Risk multiplies when stacked with clenbuterol or ephedrine, thermogenic stimulants. Anabolic steroids, which already increase blood pressure and strain the heart. Diuretics in final week, stress the heart. Safer alternatives. Non-stimulant wakefulness agents like modafinil or armodafinil. Caffeine plus L-theanine for mild focus. Nutritional support, tyrosine, dopamine precursor, for focus. Proper diet planning instead of stimulant-based appetite suppression. Conclusion. Concerta is not the most hardcore stimulant in bodybuilding, but that's exactly why some athletes like it. It gives steady focus, lasting energy, and consistent appetite suppression without the intense highs and crashes of amphetamines. But Concerta is still far from safe. It can affect the heart, blunt natural dopamine, and cause long-term psychological dependence. For bodybuilders, it's a balancing act. Do you want stable focus and energy, or do you risk turning a medication into another dangerous performance enhancer?